Granny Know-It-All. That's what they'd started calling her in the corridors of Seattle General, whispered between residents during rounds, scribbled on a sticky note someone left on the break room refrigerator. Granny Know-It-All, the civilian nurse who asked too many questions, who moved with a precision that made the younger staff uncomfortable, whose hands never shook when a patient coded. Dr. Marcus Blackwell had heard the nickname 3 times in 2 weeks, and he'd smiled each time. Mockery was a tool. A useful one. But Margaret Walsh didn't seem to notice the mockery at all, which made his smile fade. She was something he didn't yet understand, and Dr. Blackwell did not tolerate unknowns. They didn't know she'd spent 72 hours straight under fire in Marja keeping soldiers alive with nothing but field supplies and will. They didn't know the woman in the faded scrubs and practical bun had carried a call sign once, Reaper 6, and lived up to it. What happened next would prove exactly how dangerous the underestimated always are. Margaret Walsh arrived at Seattle General on a Tuesday in March, 3 years and 2 months ago, carrying a single reference letter and a carefully constructed lie of omission. The hospital's trauma bay had hired her because she could insert a central line in under 90 seconds with a steady hand that never wavered, because her trauma notes were precise and detailed in ways that made residents jealous, because she asked no questions about benefits or scheduling and moved through 13-hour shifts without complaint. Her hair was graying at the temples, pulled back in a practical bun that never came loose, the kind of bun worn by women who'd learned long ago that vanity was a luxury nobody who saved lives could afford. The scrubs she wore were soft from washing, faded to the color of old concrete, and they hung on her frame in a way that suggested she'd been thinner once, muscled in places civilian nurses weren't usually muscled. But nobody asked. Philadelphia wasn't a city that asked questions about who you used to be, only who you could be for them right now. The trauma bay itself was a cathedral of fluorescent light and organized chaos. The smell, that particular combination of antiseptic, floor wax, and something underneath it all that was closer to fear than anything else, hit Margaret in the same place it always did, 3 inches below her sternum, the place where muscle memory lived. She'd learned to breathe through it. The ventilators wheezed their mechanical rhythm in the corner, voices called out vital signs in a cadence she could follow in her sleep, and the monitor screens cast their pale glow across faces that looked simultaneously 10 years older and 10 years younger than Margaret's own 47. On her first shift, she'd been assigned to Trauma Bay 4, where a 17-year-old with a GSW to the abdomen was losing consciousness and the surgical resident ordering the fluids was panicking just enough that his voice went up half an octave. Margaret had watched him order 2 units of O-negative instead of 4, watched him reach for a central line kit when what the kid needed was a fast scan and direct pressure, and she'd said nothing. She'd simply moved, her hands reaching for the right equipment before anyone asked, her body remembering protocols written in muscle and bone instead of hospital policy manuals. The resident, his name was Torres, 26, 6 months into his residency and still believing that confidence was the same as competence, had nodded at her, grateful for the help. The attending physician had been in another room. And Margaret had done the job the way it needed to be done, the way she'd learned it when lives were only ever 3 seconds away from ending. It took exactly 4 minutes. The kid made it to surgery. The kid made it out of surgery. The kid would walk again, probably, and that was enough. That was always enough. But Dr. Marcus Blackwell had been standing in the observation gallery above the trauma bay. He'd watched the entire sequence through the glass, his arms crossed, his expression the particular kind of neutral that meant his mind was working very fast. He was tall in the way that made people listen before he spoke, 6'3", shoulders that suggested he'd rowed crew in college, the kind of jawline that cutting boards envied. His hair was graying too, but his was a distinguished gray, the kind that made him look more authoritative, not more tired. At 51, he'd been chief of surgery at Seattle General for 7 years, and in those 7 years he'd built a very specific version of the hospital's trauma protocols. They were his protocols. They operated according to his logic. They succeeded or failed based on his decisions. And then a woman who'd been hired at minimum wage had walked into his hospital 3 years ago and begun, very quietly, to know things she shouldn't know. It started small. 3 months into her tenure, Margaret caught a post-operative infection that Blackwell's discharge summary had missed. A patient admitted for a routine appendectomy, released on day 3, returned on day 5 with a fever that was climbing toward sepsis and an infected abdominal wound that should never have been closed without proper irrigation. Margaret had been pulling the patient's chart for a routine vitals check when she saw it, the fever progression, the inflammatory markers, the timeline. She'd flagged it directly to the attending physician, not to Blackwell, never to Blackwell. She was careful about that, and the patient had been readmitted, treated, recovered. Blackwell had handled it with the grace of a surgeon who'd made a minor oversight in a perfectly understandable context. These things happened. Surgery was an art. Minor infections were occupational hazards. But then it happened again, 6 weeks later. A different patient, different procedure, same attending. A medication error this time. A resident had written 0.8 milligrams of epinephrine when the order should have read 0.08 milligrams. A tenfold overdose. Margaret caught it at the second verification stage, her eye scanning the chart in that way she had, slow and thorough, the way someone scanned for IEDs in tall grass, and she'd simply brought the chart to the resident, not accusing, just factual. Torres, it's the epinephrine. Check your decimal. He'd gone pale. He'd caught it. Nobody died. Nobody even got hurt because Margaret Walsh's hands knew how to read situations the way other people's hands knew how to tie their shoes. And this time, Blackwell had seen her do it. He'd been on rounds, watching the case, watching Torres, watching Margaret move with that same quiet precision, that same absolute absence of hesitation. She'd handed the chart back and walked away before anyone could thank her, before anyone could make a scene, before the junior resident could feel the shame of being corrected in front of an attending. But Blackwell had seen her hands. He'd seen how she never looked at Torres, how she never made him feel small, how the correction was so gentle it took him a moment to realize he'd almost killed someone. That was the moment Blackwell understood Margaret Walsh was not a good nurse. She was something else entirely. Something competent in a way that made competence itself look like a threat. The staff locker room was quiet at 2 p.m., that sweet spot between the chaos of morning rounds and the arrival of the afternoon shift. Margaret opened her assigned locker, number 43, the brass cold against her fingers, and reached for her jacket. On the small shelf inside, she kept a photograph, faded at the edges, the kind of photograph that had been taken before digital, when photos were treasures instead of evidence. In the image, a younger Margaret stood in desert camouflage, her hair longer than, her face lean and sun-darkened, surrounded by 8 medics of her unit. All of them were smiling. All of them were looking at the camera with that specific kind of exhaustion that came from knowing you'd kept people alive today. She touched the corner of the photograph once, her thumb tracing across a face on the far right, Sergeant Marcus Gaines, Dark Horse Company, 3rd Battalion, 5th Marines, and then she closed the locker door. The sound of it closing was like a hatch sealing. She did not look back. The footsteps on the tile came before she'd even gathered her jacket fully. Boot heels, deliberate. She recognized the rhythm. Dr. Blackwell didn't walk like other surgeons walked. He moved with the kind of intentional control that suggested he was aware of every molecule of air his body displaced. Margaret turned, her face settling into the expression she'd perfected 3 years ago, pleasant, neutral, professional, with just enough deference to confirm his suspicion that she knew her place. She was 47 years old, and she'd learned how to disappear inside herself at 24, so this was easy. This was the easiest thing. Nurse Walsh. His voice was like a tank idling in a garage, all low authority with barely contained power. He was close enough that she could smell his cologne, something expensive, something that probably cost more per ounce than she made in a week, and close enough that she could see the exact moment his eyes moved to her belt, to the trauma shears clipped there. The shears were polished steel, catching the fluorescent light. The engraving was too small to read unless you knew to look for it. The call sign was there though. Reaper 6. She'd never hidden it. She'd simply never invited anyone to look closely enough to see. I need to speak with you about your initiative. Your tendency to observe matters that perhaps fall outside your scope. Margaret's hands were steady. They'd been steady under fire. They were certainly steady now. She waited, saying nothing, because she'd learned that silence was often the best response to threats disguised as casual conversation. The way his jaw tightened suggested he'd expected a different response, nervous, perhaps, or defensive. Instead, what he got was her absolute composure, which was somehow worse. "You corrected a resident's medication order yesterday." Blackwell's eyes were pale blue, the kind of blue that looked cold even when the man using them was warm. He was studying her the way a biologist studies an organism that's failed to behave according to the expected model. "You flagged an infection I approved for discharge. These are not decisions that fall within the nursing scope of practice, Nurse Walsh. Regardless of how accurate your observations happen to be." "Yes, Doctor." She said it quietly. She said it with the exact amount of deference that would confirm his assumption that she was simply an overzealous nurse, slightly too involved in her work, perhaps a bit of a caregiver's martyr complex. She said it in a way that completely erased the fact that she'd held a commission in the United States Navy, that she'd been responsible for 63 medics and the lives of everyone they treated, that she'd done this job in conditions that made this antiseptic corridor feel like a 5-star resort. "I'm glad we understand each other." Blackwell's smile was the smile of a man who'd just confirmed his worldview. "I'm sure you'll continue to be an excellent nurse." "As a nurse." "No more." He turned, his footsteps echoing as he walked away, and Margaret stood alone in the locker room with the sound of the ventilators humming through the walls, with the distant sound of a monitor alarm, with the particular sound of knowing exactly what was about to begin. Blackwell had decided she was a threat. Blackwell had decided to do something about it. And the quietest person in the room had just become very, very dangerous. Thursday morning arrived with the kind of fluorescent brightness that made everything feel staged and false. The conference room at Seattle General smelled like stale coffee and the particular antiseptic staleness of a room where people gathered only out of obligation. 23 personnel crowded the table, residents, nurses, surgical techs, administrators with their tablets and their clipboards and their carefully neutral expressions. Margaret sat in the third row, her notebook open to a blank page, her hands folded in front of her like a student preparing for an exam she hadn't studied for. Dr. Blackwell stood at the head of the table, his white coat pristine, his smile the smile of someone who had never once doubted his own authority. The supply inventory report droned on, bandage counts, suture types, equipment requisitions, and then he raised one hand, a gesture of such casual dismissal that the resident speaking actually stopped mid-sentence. "Nurse Walsh," he said, and the room shifted. "Perhaps you can enlighten us on the Whipple procedure. Surgical approach. Vascular considerations. Pancreatic reconstruction technique." The silence that followed felt like pressure building in a sealed room. Margaret looked up from her notebook, her grey eyes steady, her hand still flat on the table. She didn't flush. She didn't look away. Every person in that room was watching her now, a few with phones already angled downward like they were recording theatre. "That's outside my scope of practice, Dr. Blackwell," she said quietly. His eyebrow rose in mock surprise, the expression of a man who had just confirmed exactly what he was looking for. "Humor us. You seem to have opinions on everything else." The way he said it made the opinions sound like an accusation, like she'd been caught stealing. She took one measured breath, her shoulders settling as if she were shrugging off a weight that didn't exist. When she spoke again, her voice was so calm it sounded rehearsed, though nothing about her was rehearsed. This was something older than rehearsal. This was muscle memory. "I'm here to discuss nursing protocols, not surgical procedures I'm not licensed to perform," she said. His smile sharpened into something that looked less like humor and more like the edge of a blade. "Of course. Know your limitations. Continue, everyone." He waved the resident on, but his eye stayed on Margaret for exactly 2 seconds too long, and in that extra moment, she understood that this wasn't the beginning of something. This was the opening move in a campaign he'd been planning since the moment she'd corrected his dosage order 6 months ago. 2 weeks crawled past. Margaret worked her shifts with the steady precision of someone who had been trained to function in hostile environments where hesitation meant casualties. She moved through the hospital corridors like a ghost haunting her own life, present but not present, visible but somehow invisible. The other nurses sensed something around her, a kind of cold professionalism that discouraged conversation. She was still good at her job. Still competent. Still dangerous to people like Dr. Blackwell, who needed to feel like they were the smartest person in any room they entered. It was a Tuesday when the elevator moment happened. Margaret finished a double shift at 19:30, her feet aching in a way that felt like an old language her body still remembered, the bone-deep exhaustion of decisions made under pressure. She walked toward the bank of elevators on the 3rd floor, her badge clipped to her scrub pocket, her stethoscope wound around her neck like a noose she'd learned to live with. The doors opened on the north elevator, and Dr. Blackwell stepped partially inside, then extended his arm across the doorway with the casual confidence of someone who had never once been told no by a nurse. He was 6 inches taller, and he used that height the way some men used money, as a tool of intimidation. "You've been here 3 years, Margaret," he said, his voice dropping into the register of someone sharing a secret with a confidant. 3 years of thinking you're smarter than the people who actually went to medical school. She stood motionless in the hallway, her hands at her sides, her posture loose. Everything about her suggested she was listening, which she was, but not in the way he thought. She was listening like someone trained to read threat patterns, and every word he spoke was a word that would later matter in ways he couldn't imagine. "Let me be clear," he continued, and his voice had the quality of a predator testing the boundaries of its prey's fear. "You're a nurse. A good nurse follows orders. A problem nurse gets reassigned to bedpans and sponge baths until she remembers her place. Which kind are you?" The moment stretched like taffy pulled thin. Margaret held his gaze, direct, unflinching, the kind of eye contact that made weaker men look away first. And then she felt something hot trace down her weathered cheek, a single tear that surprised her more than it would have surprised him. She wiped it away with the back of her hand before he could fully register it. "The kind who saves lives while insecure men play hierarchy games, Dr. Blackwell," she said. Then she stepped around his arm and into the elevator. The doors closed on his reddening face, and she heard him exhale hard, not quite a curse, but close enough. The next morning, Margaret arrived for her shift at 6:45. The locker room was empty except for the faint smell of industrial cleaning products and the particular silence of a space designed for privacy that nobody actually received. She opened her locker, the metal door swinging on hinges that had probably been oiled since before she arrived at Seattle General, and stopped. Her locker was spray-painted. Red letters, thick and dripping, the paint literally running down the metal like something had bled there. Granny Know-It-All. The letters were huge, impossible to miss, impossible to ignore, and the way the paint ran made them look like they'd been applied with violence, like someone had been very angry about it. She stood before that vandalized door for 5 seconds. Her hands were still loose at her sides. Her breathing was steady. A small crowd began to gather, staff arriving for their shifts, pausing, looking away, some of them looking at their phones because it was easier than looking at the locker or at Margaret's face. And then she turned. Dr. Blackwell was leaning against the far wall, his arms crossed, one eyebrow raised in an expression of mock curiosity so false it could have been read from the audience of a theater. He was waiting to see her flinch. He was waiting to see her cry. He was waiting to see the moment when the hierarchy reasserted itself and she remembered exactly who held the power in this building. Margaret's voice was quiet. Not whispered, quiet the way a scalpel is quiet before it cuts. It carried to every corner of the locker room, and every person who heard it stopped pretending to look away. "Insecurity always attacks what it can't comprehend," she said. She opened the locker, the same locker with the graffiti bleeding down its face, retrieved her stethoscope from the shelf, and walked to her shift. Her pace didn't change. Her posture didn't change. The only thing that changed was the expression on Dr. Blackwell's face, which shifted from anticipation to something that looked like shock, and then, worst of all for a man like him, doubt. The morning proceeded in the ordinary rhythms of a hospital, patients admitted, charts reviewed, medications distributed, the small dramas of human bodies in crisis rotating through the trauma bays like scenes in a play nobody had chosen to attend. Margaret moved through it all with the composed efficiency of someone who had learned long ago that the world would do what it wanted regardless of how you felt about it. You simply did your job and did it well. Then, at 14:37, the intercom crackled. Trauma incoming, Navy personnel, IED injuries, ETA 6 minutes. The words came through the speaker in a flat, administrative voice, but Margaret's entire body responded as if someone had thrown a switch. Her spine straightened. Her shoulders squared. Something old and deeply trained moved in her chest, a reflex that had been dormant for 3 years but never actually gone. She was changing a central line dressing on a patient in room 403 when she heard it, and her hands finished the motion, precise, careful, professional, before she excused herself and headed toward the trauma bay. She made it as far as the third-floor hallway before Dr. Blackwell intercepted her. He was moving with purpose, his face arranged in the expression of a man making an administrative decision. "Nurse Walsh, you're reassigned to pediatrics for the remainder of your shift," he said. His voice was calm. Rational. The voice of someone who wasn't being petty at all, he was simply managing resources. "Nurse Chen will cover trauma. Dr. Blackwell, the incoming patient, is a trauma case with multiple personnel already assigned." He cut her off, and his smile was the smile of someone playing chess 3 moves ahead. "Is there a problem with that assignment? I'm the chief of surgery. I determine staffing requirements." He walked away before she could respond, his shoes squeaking on the linoleum floor with a sound like rubber on glass. Margaret stood in the hallway, her jaw tight, her hands in fists at her sides, doing the calculation that every military person learned eventually, the calculation of when to push and when to accept the limits of what you could control. Pediatrics was 2 floors up and worlds away from the kind of medicine that made her hands remember. She spent the next hour with a 7-year-old who'd broken his arm falling off a skateboard, twins with matching ear infections, a toddler with a fever that turned out to be nothing at all. The work was competent. The work was kind. The work was completely and utterly the wrong kind of work for what she could actually do. At 15:45, she took her mandated break. She didn't go to the break room. She took the stairs, down instead of up, down into the basement and back up through the fire exit that opened on the 2nd floor, the long way around to the trauma bay. Her hands were moving, her legs were moving, the part of her that had learned to operate in the margins of hospitals during peacetime as well as war was moving, and she was pretending it was just a break, just a walk, just a nurse checking on something she shouldn't be checking on. The trauma bay at 1550 was controlled chaos. Residents were moving with that particular intensity that came from high acuity cases. Monitors beeped their varied tones, each one a different blood oxygen level, a different heart rate, a different story. And in bed 3, she saw him. The patient was maybe 30 years old, his face grey with pain that medication couldn't quite touch, his left leg elevated and wrapped in the kind of temporary dressing that suggested nobody had wanted to commit to anything permanent yet. His uniform jacket hung on the chair beside the bed, and Margaret recognized the patch before she consciously registered seeing it. The same unit patch she'd worn in Marja. The same unit that had replaced her team when she'd rotated out, back when she'd still believed she could have a normal life. She approached the nurse's station and pulled his chart. Admiral James Reeves, 41 years old, multiple shrapnel wounds from a vehicle that had been parked exactly 3 meters too close to an IED, broken ribs, left leg trauma with concerning swelling. The kind of swelling that looked like pressure building inside a sealed container. She read the notes, her finger tracing the pressure readings documented in the trauma assessment. 32 millimeters of mercury 2 hours ago. 38 millimeters an hour ago. No current reading logged. No fasciotomy ordered. No sense of urgency in the notes that suggested anyone understood what was happening in that leg, that the pressure was building toward the point where tissue would start to die from the inside out. She found Dr. Morrison in the hallway, pulling him aside from the controlled chaos with the kind of quiet insistence that suggested it was important but not urgent. His left leg. The compartment pressures are climbing. He needs immediate evaluation for compartment syndrome. Morrison barely glanced up from his tablet, his eyes flickering down to her name badge and then away. Dr. Blackwell reviewed the case personally. He's scheduled for a surgical consult tomorrow morning. We're managing the pain. Tomorrow will be too late, Margaret said, and she meant it the way you meant things when you'd actually seen what happened when pressure built unchecked in a closed space, the tissue death, the infection, the eventual amputation or sepsis, or the kind of slow infection that ended people's lives long after the initial injury should have been history. But Morrison was already walking away, pulled back toward another crisis, another patient, another decision that required his attention. Margaret returned to the trauma bay at 15:52, ostensibly checking on another patient but actually looking at Admiral Reeves' leg. The swelling had visibly increased. The skin was stretched tight and shining, the kind of shining that came from fluid pressure, and his pain level had spiked despite the medications they'd pushed into his fall line. She flagged the surgical resident directly at 16:05. The response came back as a message in her phone within 8 minutes, case reassigned to Dr. Patterson, junior resident, currently in surgery. Will evaluate at 1800 hours. 2.5 hours. She stood outside the trauma bay, standing where she could see Admiral Reeves' pale face, his elevated leg, the monitors that showed his blood oxygen trending slightly down and his heart rate trending slightly up, and did the math. The math she'd learned in a very different hospital, under mortar fire, when waiting meant body bags and when she'd had the authority to make decisions that saved lives. The math that didn't change just because she wore a different uniform now. The intercom crackled at 16:06, breaking through the afternoon routine like shrapnel. Trauma alert. Multiple inbound. Navy personnel with blast injuries. ETA 6 minutes. Margaret's hands didn't pause. She was halfway through threading a central line into a septic patient's subclavian vein, the needle poised at the precise angle that meant the difference between sterile access and a collapsed lung. The fluorescent lights hummed their mechanical song above her. Around her, the pediatric wing continued its oblivious rhythm, monitors beeping gentle numbers, children sleeping off anesthesia, parents in waiting rooms checking their phones. She finished the line with the fluid precision of someone who'd done this 10,000 times, taped it down, checked the chest X-ray confirmation on the monitor. Clean placement. No pneumothorax. Good. She stripped off her gloves, walked to the sink, and started scrubbing her hands even though she already knew what was coming. Blast injuries meant Seattle General's trauma bay would transform into controlled chaos within minutes. Multiple casualties. Navy personnel. The words clicked together in her mind like a lock opening. She arrived at trauma intake just as the first Black Hawk's rotors shook the windows. The percussion of helicopter blades sounded like distant artillery to her, that familiar pressure in the chest, that old muscle memory sitting up like a dog hearing a whistle. The paramedics wheeled in a corpsman with shrapnel embedded in his right shoulder, his face twisted in agony. Behind him came another stretcher. Then another. Margaret stood back, letting the attending physician swarm, watching the controlled violence of emergency medicine unfold. She knew her place in this moment. Junior staff. Observer. The woman in the corner with practical grey hair and a surgical mask who blended into the sterile tile walls. Then she saw him. The fourth stretcher. The young man on it had the same sharp features she remembered, the same steady eyes now dimmed with shock and pain. Admiral James Reeves. 28 years old. Former Petty Officer First Class, Special Warfare Command, the medic who'd replaced her in Marja 7 years ago when she'd retired and handed off her command. She'd trained him herself. Watched him evolve from a kid who flinched at blood into a healer who moved through chaos like water finding its channel. His left leg was swollen to nearly double its normal size, the skin tight and mottled, already taking on that terrible dusky hue that meant the muscle inside was beginning to die. Margaret moved closer, her eyes tracking the stretcher. She didn't think. She simply observed, the way she'd observed combat situations for 18 years, taking in details while her conscious mind stayed perfectly still. For access, good. 2 large bore lines. Vitals being called out, BP 118/76, heart rate 94, O2 sat 96 on high-flow oxygen. Pain score reported as 8 out of 10. The attending physician, Dr. Patterson, was listing off his injuries, blast fragmentation to the left lower extremity, possible compartment syndrome, right shoulder laceration requiring sutures, possible internal injuries pending CT. Compartment syndrome. There it was. The diagnosis spoken aloud like someone reading a grocery list, already moving past it, assuming it had been flagged, already assigned, already being managed. Except it hadn't been. Margaret knew the mathematics of compartment syndrome the way other people knew their children's birthdays. Tissue pressure above 30 millimeters of mercury begins to compromise circulation. Above 45, irreversible muscle death begins. The timeline moves in minutes, not hours. Every moment the pressure climbed, muscle fibers died. Every moment of delay meant future amputation, chronic disability, a lifetime of phantom pain. She watched as Dr. Patterson ordered initial pain management, vascular ultrasound, and transfer to the surgical ward for monitoring. Monitoring. As if time existed in abundance. As if this wasn't a ticking clock already counting down. Dr. Blackwell appeared then, moving through the trauma bay like a man surveying a kingdom. His navy sport coat, expensive, Brooks Brothers, the kind that whispered old money, stood out against the surgical whites and scrubs. He glanced at the Admiral's chart without touching it, nodded at Dr. Patterson, and made some comment about good preliminary assessment before walking back toward his office. Margaret watched this transaction the way a cat watches a mouse hole. Competent dismissal. Confident abandonment. The confidence of a man who'd never had to make decisions under fire, who'd never watched people die because of a mistake made in haste. She approached Dr. Patterson quietly. "The compartment pressure readings," she said. Her voice was pitched low, professional, non-threatening. "We should get baseline measurements now. The swelling pattern suggests." "The radiologist will flag anything critical," Dr. Patterson said, already moving to the next patient. "Not unkind. Just busy. Just delegating upward through the system that was supposed to catch exactly this." Margaret nodded and stepped back. 20 minutes later, after the initial rush had crested and the Admiral had been moved to a monitoring bed in the surgical ward, Margaret approached the nurse's station where the attending was reviewing images. "The Admiral's leg," she said. "His pressure readings. I think we should check them now rather than wait for." "Already ordered," Dr. Patterson said without looking up. "Results should be back in 30 minutes. He's on pain management. He's stable for now." The word now hung in the air like a warning she was choosing not to hear. The third time she tried, it was different. She'd seen the bed assignment. She'd seen the notation, Margaret Walsh, pediatric assignment. Dr. Blackwell's voice still echoing in her memory from earlier that week, casually announcing in front of 3 residents that the pediatric wing had been short-staffed and deserved her attention. A strategic reassignment disguised as need. She understood tactical moves well enough to recognize one being made against her. But none of that mattered. What mattered was a man who couldn't feel his own leg beginning to die. She found Dr. Blackwell outside the surgical suite and pulled him aside, away from listening ears. "Admiral Reeves," she said quietly. "His compartment pressures are climbing. We need to measure them now. The timeline on compartment syndrome is tight. The attending physician is fully capable of managing post-trauma assessment," he said. His voice carried the temperature of deep water. "Your responsibility is the pediatric ward, Ms. Walsh. I'd suggest you return to it." He smiled. It was the smile of a man who'd just made a chess move and was watching the other player realize they couldn't undo it. "Unless you'd like to explain to the director why you're questioning the clinical judgment of the attending physician." The unsaid threat was crystalline. Question his competence in front of another doctor, and she'd be challenging the hierarchy itself. He was betting she'd back down. He was betting she'd accept the boundary he'd drawn, the cage he'd built around her authority. She returned to pediatrics at 16:58. Changed a colostomy bag on a 6-year-old girl who'd survived bowel perforation from appendicitis. Reviewed discharge instructions with a mother whose son had just completed his final chemotherapy round. documented vital signs and medication administration with the meticulous precision that turned invisible work into visible record. She clocked out at 5 p.m., the moment her shift ended, watching the seconds tick over on the computer clock. For exactly 3 minutes, she considered going home. Considered accepting the boundary. Considered being exactly what Seattle General had hired, a competent, reliable nurse who knew her place and never questioned the attending physicians and certainly never stepped outside her scope of practice. At 17:03, she walked back to the locker room, changed into surgical scrubs from her personal supply, the set she'd brought just in case, the way soldiers keep emergency rations, and pulled her hair back tighter into a bun that could withstand sweat and motion. She didn't think about the consequences. She didn't think about Dr. Blackwell or licenses or the enormous violation of protocol she was about to commit. She thought about the compartment syndrome mathematics. She thought about the time calculations. She thought about a young man she'd trained in Marja 7 years ago, who trusted her then and wouldn't even recognize what he needed from her now. The trauma bay had returned to routine afternoon status. Most of the paramedics had left. The initial chaos had settled into monitoring and waiting. Margaret walked through the surgical ward with the absolute confidence of someone who belonged, the kind of invisible permission that came from moving like you owned the space. No one questioned her. No one asked why a pediatric nurse was walking toward the trauma beds in fresh surgical scrubs. The invisibility was her armor, her camouflage, the thing she'd learned in Marja when being noticed meant being targeted. Admiral Reeves was alone in his curtained bay, the initial rush of his arrival having passed, relegated now to the automated monitoring of machines and the intermittent checks of busy nurses. His face had gone pale beneath his tan, sweat beading on his forehead like morning dew. His breathing had shifted into the shallow pattern of someone in significant pain despite the medications dripping through his full line. When Margaret stepped to his side and touched his left leg through the sheet, he gasped. The sound wasn't anger. It was pure reflex. The body recognizing its own crisis. "Sir, I need to check your pressure readings," Margaret said. Her voice was steady, professional, and she didn't wait for permission. She'd moved past asking. She pulled back the sheets and unwrapped the dressing with practiced efficiency. What she saw confirmed every calculation she'd made. The leg was tight as a drum, the skin mottled with that terrible dusky purple that meant muscle tissue was suffocating. The normal pinkish tone had drained away completely. She palpated for pulses. The dorsal pedal was barely there. The posterior tibial was almost gone. She measured the compartment pressure with the plastic needle and syringe, watching the mercury climb, 43 millimeters of mercury. Then 45. Then 47. Irreversible damage began at 50. She had minutes, maybe less. Margaret's hands moved with the terrible calm that comes from having already made a decision. She paged the surgical resident. No answer. She called the attending physician's line. Voicemail. She walked to the OR board and read the schedule with eyes that had learned to process information under mortar fire. Dr. Patterson was still in surgery with another 90 minutes minimum. Dr. Blackwell was listed as off-site. There was no one coming. There was no attending physician available. There was no system that was going to save this man's leg in the time window that existed. Margaret returned to the Admiral's bed. She pulled the curtain around it, creating a small island of privacy in the bay. She scrubbed her hands with the thoroughness of someone who'd done this 1,000 times, under field tents, in makeshift surgical areas, in forward operating bases where sterile meant as clean as possible under fire. The soap hissed against her skin. She snapped on gloves with the sharp sound of latex sealing against her palms. She reached for her trauma shears, hanging from her belt where they'd hung for 7 years, the engraving catching the harsh fluorescent light, Reaper 6. The first incision was precise. Lateral compartment release along the fibula. The pressure released immediately, and the change in tissue color was instantaneous, the purple fading back toward something approximating life. She made the medial release, watching muscle fibers pink up as circulation returned, as oxygen found its way back to tissue that had been suffocating. The hiss of air escaping. The smell of antiseptic and blood. The weight of what she was doing settling on her shoulders like a uniform she'd taken off years ago, but that still fit. She was closing the wound with careful sutures, her muscle memory deeper than conscious thought, when the voice came from behind her. "What the hell do you think you're doing?" Dr. Blackwell stood in the curtain opening, his phone already in his hand, already taking photographs, his face not flushed with rage but cold with calculation. She didn't turn. She didn't pause. She tied off the final suture, cut the thread, and only then looked at him over her shoulder. The silence lasted exactly 3 seconds. Then everything changed. Margaret clocked out at 5 p.m. but she didn't leave. She changed into fresh surgical scrubs pulled from her locker, the fabric still carrying the antiseptic smell of the hospital laundry. Her hands moved with the calm of muscle memory, no hesitation, no second-guessing. She knew what was coming. She'd known it the moment she saw those pressure readings climbing. She moved through the corridors like someone moving through water, each step deliberate, her presence drawing the kind of quiet attention that made people step aside without knowing why. The Admiral lay in Trauma Bay 4, and the sight of him stopped her breath for exactly 1 second. His face was the color of old concrete. Sweat beaded across his forehead and upper lip, and his left leg, the leg she'd been tracking all afternoon, had swollen to something that no longer looked quite like a human limb. The skin was tight and shining, stretched thin like a balloon 3 breaths away from rupture. She checked the monitor beside the bed, blood pressure dropping, heart rate elevated to 118, and the compartment pressures on the ultrasound screen read 48 millimeters of mercury. 50 was the point of no return. 50 was when tissue began to die, when nerve damage became permanent, when a saved leg became an amputated one. He had maybe 6 minutes of safe window left. "Where's Dr. Morrison?" she asked the resident monitoring the patient, her voice low and steady. The resident, a kid named Garrett, barely 30, looked up with the exhausted expression of someone drowning. "Emergency C-section." He's scrubbed in, can't break. I called for the next available surgeon. ETA 40 minutes. 40 minutes. The words hung in the air like a death sentence. Margaret pulled out her phone and called the attending physician directly, her voice professional and clipped, compartment pressures critical. "Patient needs fasciotomy now." The attending's voice crackled back, "Blackwell's handling surgical decisions. I'm not primary on this case." She hung up and called Dr. Blackwell's line. It rang 4 times and went to voicemail. Of course it did. Margaret stood at the foot of Admiral Reeves's bed and made the calculation that would end her civilian career. She could watch him lose his leg, or she could use the hands that had held together 72 hours of continuous combat medicine in Marja. There was no choice in it at all. She turned to the resident. "Get me a fasciotomy tray. Size for scalpel, bovie, skin markers, and a unit of ONEG typed and ready for transfusion. Do it now." "The doctor hasn't ordered." "Do it now, Garrett." Her voice had dropped an octave. It was the voice she'd used when coordinates were incoming and morphine was running low. It was the voice that made people move without questioning why. The resident moved. She scrubbed in at the sink beside the bay, her hands under the scalding water, watching the soap foam and rinse in automatic rhythm. The fluorescent lights buzzed overhead like captured electricity. Through the window she could see the parking lot filling with the purple shadow of late afternoon, and she thought about the life she'd tried to build, the quiet she'd tried to find, and how some debts transcended the distance between the uniform and the scrubs. She dried her hands on sterile towels and stepped back into the trauma bay where mortality was waiting. "Admiral," she said, and his eyes focused on her face through the haze of pain medication. "I'm going to fix this." She didn't wait for his response. The fasciotomy tray was already open, instruments laid out like chess pieces. She marked the fascial lines on his lower leg with a skin marker, 2 parallel lines running from knee to ankle, mapping the compartments the way she'd done it 100 times in field conditions where the nearest surgeon was 14 kilometers and under fire. The muscle compartments of the lower leg were pressurizing, cutting off blood supply to the tissue. In combat, they'd called it death by inches. Her hands moved like machinery with no rust. The scalpel went through skin in one confident motion, blood welling up in a thin red line. The bovie hissed as she sealed the bleeding vessels, the smell of cauterized tissue, copper and char, filling the small space. She worked from proximal to distal, releasing the anterior tibial compartment first, the blade finding the fascial layer beneath the muscle the way a key finds a lock. The muscle itself bulged through the incision like it was gasping for air, and she knew she'd gotten there just in time. "Suction," she said, and Garrett was there with the instrument, his face pale but his hand steady. She moved to the lateral compartment next, then the posterior. The blade was sure in her grip, steadier than her heartbeat, steadier than any measure of fear. This was the thing she'd learned in war that peacetime couldn't teach, that crisis clarified everything, that uncertainty evaporated when you'd already survived the worst the world could offer. Her trauma shears hung from her scrub pocket, engraved with the call sign Reaper 6 on the stainless steel, a relic she'd never put away, and she used the smaller blade to make the precise releases that would let the blood flow back through tissue that had been drowning. The procedure took 17 minutes. When it was done, the Admiral's compartment pressures had dropped to 22 millimeters of mercury, safe, survivable, recoverable. She closed the incisions with methodical precision, suturing skin to skin in the neat interrupted pattern that would heal clean. Her hands did not shake. They never did. She was tying off the final suture when the trauma bay doors opened and Dr. Blackwell walked in. He didn't shout. He didn't turn red or make a scene. That was what made it worse, what made her understand in that moment that she'd miscalculated the threat. Blackwell's face was a study in perfect composure, and his eyes were the eyes of someone who'd just been handed exactly the ammunition he needed. He stood in the doorway for 3 full seconds, observing the open incisions, the suture in Margaret's hand, the Admiral's elevated leg with the surgical dressings already being applied. Then he pulled out his phone and took for photographs in rapid succession, one of the open fasciotomy from above, one from the side, one of Margaret's hands mid-suture, one of her face. "Step away from the patient, Nurse Walsh," he said, his voice carrying the precision of a closing argument. Margaret tied off the final suture and cut the material. She peeled off her gloves in the methodical way you did when there was no urgency left, when the work was finished and what remained was only consequence. The gloves made that small snapping sound as she pulled them inside out and dropped them in the biohazard container. Blackwell was already on his phone. "Yes, Director Chen, I need you in Trauma Bay 3 immediately. We have a situation." Pause. "No, it's not a medical emergency. It's an administrative matter. I'll brief you when you arrive." He hung up and gestured to the 2 security guards who'd materialized in the doorway like they'd been summoned by his tone alone. Margaret recognized them both, Tom and Jessica, good people who looked like they'd rather be literally anywhere else. She gathered her personal items from her locker, a photograph of her son, a book she'd been reading for 6 weeks, the small things that constituted the exterior of a civilian life, and walked out of Seattle General between them, past the nurse's station where colleagues' eyes tracked her with the shock of watching someone disappear in the middle of an ordinary day. 15 minutes later she sat in a windowless office with Director Chen, the chief nursing officer whose name was Patricia, and Dr. Blackwell. He presented his case the way he presented everything, with the cold efficiency of a prosecutor building a case he'd already won. Photographs. Documentation. Witness statements. The words "practicing medicine without a license" and "criminal conduct" appeared with the regularity of a metronome. "Margaret, is this true?" Director Chen asked, and Margaret heard in that question the death of something she'd been trying to protect. Admiral Reeves had compartment syndrome with pressures at 48 millimeters, she said, her voice level, her hands folded in her lap. Irreversible damage occurs at 50. No surgeon was available for another 40 minutes. His leg would have been lost. "But you're not a surgeon," Patricia said, and there was pain in her voice, genuine pain. "No, I'm not." The room went so quiet you could hear the fluorescent hum. Director Chen's face was grave in that particular way that meant the decision had already been made, that what remained was only the machinery of formal process. "I have to suspend you pending investigation. Your badge, your access card." Margaret removed them slowly and placed them on the desk, the badge she'd worn for 3 years, the access card that had opened every door in this hospital, the physical representation of the identity she'd constructed. They sat between her and the director like evidence of a crime she'd committed by saving a life. Tom and Jessica walked her out through corridors she'd traveled 1,000 times, past the trauma bay where Admiral Reeves slept with a saved leg, past the locker room where someone's vandalism still decorated her door in red letters. The afternoon sun hit her face when she stepped outside, and for a moment she stood completely still, a woman suspended between lives, belonging fully to neither. Her hand started shaking somewhere on the drive home, on the stretch of Route 76 where traffic was light and she could hear nothing but the white noise of the road. She pulled into her driveway at 14:20 on a Thursday afternoon, a time her body had never known, a time that could only mean everything had broken, and sat at her kitchen table with her face in her hands, crying in a way she hadn't allowed herself to cry since she was 23 years old, and watching the medic who'd replaced her in Margaret get loaded onto a helicopter with shrapnel in his leg. She cried for the career she'd chosen to escape, the one she'd loved, for the quiet she'd tried to purchase with anonymity, for the service she'd honored by not trading on it, for the choice she'd make the exact same way if given the chance, and the cost she'd have to pay regardless. She didn't hear her son's car pull into the driveway early, didn't hear his backpack hit the floor in the hallway. But she heard his voice, cracking with worry in a way that made her heart fracture further. "Mom? Why are you home?" She looked up and couldn't answer. Her 16-year-old son, tall like his father, stood in the kitchen doorway and saw his mother defeated in a way he'd never seen before. He turned without speaking and walked to the garage. She heard him moving boxes, searching through the things she'd stored away and locked in silence. When he came back, he was carrying a shadow box she hadn't opened in 3 years, and inside it lived the life she'd buried. "Mom," he said, his voice steady now, determined, transforming into something older than his age, "they need to see these." Her son's footsteps echoed down the hallway as Margaret sat at the kitchen table at 2 in the afternoon, her hands covering her face, tears streaming through her fingers in a way she hadn't permitted herself in 18 years. The afternoon light cut through the window in sharp geometric patterns, illuminating nothing but her own collapse. She'd held people together through arterial bleeds and compound fractures and the kinds of trauma that rewrote a person's life, but she couldn't hold herself together now. Not after everything. Not after the firing, the walk of shame past colleagues who'd been told she was a fraud, the security escort, the badge they'd taken from around her neck like stripping a uniform from a soldier. The sound of the garage door opening pulled her attention. She didn't look up, didn't compose herself. 18 years of military discipline couldn't survive the weight of losing everything twice in a single life. Her son, 17, tall enough now to look her in the eye, old enough to understand what failure looked like, came home from school early. He set his backpack down slowly, the way someone approaches an accident scene. "Mom," he said, and the question mark in his voice broke something that had already been shattered. "Why are you home?" She couldn't answer. The words wouldn't form. He disappeared into the garage without waiting for a response. The silence that followed stretched like a living thing, full of dust and fluorescent light leaking in from the kitchen fixture overhead. Margaret heard him moving around, opening boxes, the scrape of shelving, the careful way someone handles fragile things. Then footsteps again, and he was standing in the doorway holding a shadow box that hadn't seen daylight in 23 years. The wood was still dark mahogany. The glass still gleamed. Behind it, arranged with the precision of an honor guard, were 5 medals on their ribbons, a folded uniform patch, a faded photograph of a young woman in desert camouflage with a call sign stenciled on her chest plate, and a citation typed on official Navy letterhead. "Mom," he said quietly, holding the shadow box out like an offering, like evidence, like an indictment and an exoneration all at once. "They need to see these." Margaret was too tired to stop him. Too broken to argue. She let him drive her back to Seattle General in silence, the shadow box resting on the center console between them like a living thing, like a witness, like the truth she'd buried so carefully that she'd almost convinced herself it didn't exist. The Admiral had demanded an emergency meeting with administration. Not requested. Demanded. There was a difference, and Margaret felt it in the way the hospital director had called her that morning, not with sympathy, but with the formal precision of someone reading from a script handed down from above. The conference room was on the executive level, the kind of space that smelled like expensive coffee and filtered air and the particular ozone scent of people whose job titles came with power. She walked in still wearing her civilian clothes, her son following behind carrying the shadow box. Admiral Reeve sat at the head of the conference table, his left leg elevated on a cushion stool, still wrapped in compression bandages. He was in dress uniform, navy blue, medals across his chest, the gold braid of command on his shoulder. 3 Navy personnel stood behind him, their bearing suggesting they weren't administrative staff. This was a formal proceeding. This was official. The Admiral's eyes opened wide when Margaret entered, and the room seemed to contract around a single moment of recognition. His voice, still rough with morphine and pain, dropped to something barely above a whisper. Reaper 6. 3 Navy personnel straightened to attention. Not military formality, absolute reverence, the kind of respect that didn't come from rank on paper but from something deeper, something earned in ways that couldn't be printed on credentials. A Marine liaison stepped forward, his uniform impeccable, his voice carrying the cadence of official ceremony. He opened a leather folder and began reading, for extraordinary heroism during combat operations in Marja, Lieutenant Commander Margaret Walsh rendered aid under direct fire for 72 continuous hours, resulting in a 96% survival rate among casualties evacuated through her field surgical team. For demonstrated leadership under impossible conditions, for surgical excellence in non-traditional environments, for saving the lives of 14 Navy SEALs when conventional medical support was unavailable. The conference room door burst open. Dr. Blackwell stood in the doorway, his face twisted, his expensive tailoring suddenly looking like costume armor on a crumbling foundation. "This is absurd," he sputtered, his voice hitting registers that betrayed panic. "Criminal charges. She performed surgery without a license. This is fraud. I have photographic evidence. This woman needs to be arrested, not celebrated. This is..." The Admiral's hand moved, a gesture barely larger than a breath, and his aide stepped forward with a folder that looked official enough to change weather patterns. The hospital director, Chen, Margaret remembered her name now, took it with both hands, the way someone receives something fragile or dangerous. Blackwell's face had gone pale. Not red with anger anymore, pale. The color of someone watching a structure collapse in real time. "Dr. Blackwell," Director Chen said, her voice carrying the weight of bureaucratic certainty, "your complaint against Nurse Walsh triggered a comprehensive background investigation through Navy channels, as is standard when active duty personnel are involved in civilian incidents. That investigation revealed documentation of your fellowship credentials from Johns Hopkins. According to Johns Hopkins records, you completed a 3-month rotating program, not the 2-year fellowship your CV claims." She opened the folder. Pages, dozens of them, each one a document that looked like its own little death sentence. Boston Memorial provided patient records regarding 2 surgical deaths you attributed to underlying conditions. Post-operative documentation indicates both patients developed hospital-acquired infections from inadequate post-operative care. Chicago Presbyterian released 6 formal complaints from nursing staff regarding hostile work environment, all settled under non-disclosure agreements, all now discoverable in a federal investigation. Blackwell's hands began to shake. Actual trembling, visible from the table where Margaret sat perfectly still. Additionally, Chen continued, her voice never varying in tone or emphasis, Seattle General Security provided video footage of several interactions between you and Nurse Walsh. An elevator confrontation. The spray-painted locker. Several instances of reassignment patterns that correlate with performance reviews identifying competent female staff. The State Medical Board will be receiving all of this documentation within the hour. The silence that followed was the kind that accumulates weight. Fluorescent lights hummed above them. Someone's phone vibrated against the table and nobody moved to answer it. The world had shifted on its axis and everyone could feel it except the one person who'd tried to break it. Blackwell tried to leave. Actually turned toward the door, moved his foot forward as if he could walk out of the moment, out of the consequences, out of the 1.5-year campaign he'd orchestrated to destroy Margaret's career. "Dr. Blackwell," a new voice said, female, sharp as a scalpel, with the tone of someone accustomed to being obeyed. A Navy commander, silver oak leaves on her shoulder board, stood near the door. "Hospital security and representatives from the State Medical Board are waiting outside. You'll need to surrender your hospital credentials and submit to formal questioning. It's not optional." The next 3 weeks moved with the unstoppable momentum of institutional machinery finally pointed in the right direction. Margaret was placed on paid administrative leave, but the investigation was already concluded before it began. Admiral Reeves provided testimony that felt less like an interview and more like a formal blessing. His leg had been saved by a fasciotomy performed with a precision and confidence that only came from having done it dozens of times in conditions far worse than a hospital operating room. The medical records showed the tissue damage had been halted at the surgical site, the intervention had been clinically perfect, and his recovery was proceeding exactly as it would have under any surgeon's care. Then came the certificates. Margaret had kept her military medical credentials current, not professionally, not actively, but the way someone maintains a driver's license even if they don't drive. Navy surgeon credentials. Trauma surgeon specialty certification. Surgical privileges at military medical facilities worldwide. All of it active. All of it entirely legal. The citations came after. Not just her Combat Surgeon Award, not just the Navy Commendation Medal, not just the Purple Heart she'd received for shrapnel wounds sustained during the same operation where she'd worked 72 hours without stopping. The Admiral brought a folder containing documents that made it clear Margaret Walsh hadn't been a junior officer. She'd been a command element. A leader. The surgical authority for an entire battalion operating in one of the most hostile environments on the planet. Blackwell, meanwhile, watched his world collapse with the efficient cruelty of bureaucratic accountability. The State Medical Board launched a full investigation into his credentials, and each layer revealed another deception. His fellowship from Johns Hopkins was embellished. His surgical record at Boston Memorial included 2 deaths that should have been flagged as potential medical errors. His history at Chicago Presbyterian showed a pattern of hostile behavior toward female staff that had been documented, reported, and settled quietly with non-disclosure agreements that were now discoverable. Seattle General suspended him pending investigation. 2 weeks later, the medical board voted to terminate his employment for cause, stripping his department chair position and recommending his license be reduced to supervised practice only, the professional equivalent of exile. He could still practice medicine, but only under someone else's direct supervision. Only in facilities desperate enough to accept him. Only until he finally accepted that his career, as he'd constructed it, was gone. He hired lawyers and fought every charge, appearing at hearings in expensive suits with prepared statements, but each investigation revealed another layer of systematic deception going back years. The locker vandalism had been caught on security footage he'd miscalculated. The elevator confrontation had witnesses who finally felt safe to speak. His pattern of reassigning competent female staff was documented in HR complaints spanning 5 years, all the way back to his time at previous hospitals. 6 months after Margaret's firing, the State Medical Board held its final hearing. Blackwell sat at the defendant's table, gaunt, his expensive suit hanging loose, and watched the board chairman read the decision: license reduced to supervised practice only, 5-year probation, mandatory ethics training, a permanent flag on his record that would follow him into every application, every job, every professional future he could possibly imagine. The only facility willing to supervise his practice was a strip mall urgent care clinic wedged between a vape shop and a tax preparer, its windows displaying advertisements for COVID testing and quick weight loss supplements. He took the position because the alternative was not practicing medicine at all. His first day, treating a sprained ankle and a child's ear infection, he looked out the window and saw Margaret Walsh's face on a new screen at the electronics store next door. Decorated Navy surgeon returns to trauma medicine, and felt something like the sensation of a door closing, final and absolute. Margaret started her legal process immediately, not for reinstatement, but for vindication. She contacted legal representatives who specialized in wrongful termination cases, documented every detail of Blackwell's misconduct, and prepared for the medical board investigation with the same precision she'd used to manage trauma cases. Evidence accumulated, the locker footage, witness statements, the pattern of reassignments, the falsified credentials, the chain of failures Blackwell had created and hidden behind institutional power. She wasn't fighting to reclaim a position anymore. She was fighting to reclaim something larger, the right to be who she actually was, the right to use the skills she'd spent her entire life developing, the right to exist without minimizing herself to fit into spaces designed by people too small to hold her. Subscribe for more stories about heroes we never knew existed, and comment below, if you'd been Margaret, would you have made the same choice to save that Admiral's life?